You can open up AJ while I share it to the pages.
All right, we're going to start right now. Good morning, good morning, good morning. Welcome to another COVID-19 edition of the Black Westchester Power Hour with Damon K. Jones and AJ Woodson. Our special guest for the day is Westchester County Executive George Latimer. Welcome to the show.
AJ, Damon, good to be with you both.
Good morning.
Yes. So we've been meaning to do this for a minute because we haven't had you in the studio. We haven't been in the studio for a while, but we wanted to do an update. I try to get every year. We kind of get an update, a preview, a review of the last year, and a preview of what to expect this year. We haven't had a chance to do that. I know that there's been a lot of challenges this year because we are definitely in a new normal. Turning my phone down because I keep hearing every time David shares it. Okay, there we go. Yeah, we're definitely in a new normal. I know how that has affected us as Black Westchester. We've had to navigate through, reinvent the different ways we're doing things now. How has this whole situation, changed life for you, the way you do business for the county?
Well, it's interesting, AJ, because we just passed the day before the halfway point of the year. And I was thinking back to New Year's Eve, and we'd had the county budget passed by then, and we were planning what we were going to be doing in 2020. We were just getting ready we've done our affordable housing report. We were starting regional meetings with local governments to try to push affordable housing because we know that was a need. We had some environmental plans on the dockets that we were working on. We were meeting with a group of folk on police reform issues, an advocacy group. Damon's part of that. And we had made some progress, I think, at the corrections side of the deal. We knew we had to make some progress on police reform. We had no idea what was waiting for us in the middle of March. And when the first patient came down with COVID, and just like everybody else, we saw what was going on in Wuhan, China, and we saw what was going on in Italy. And so we had no idea that we were going to be the first big cluster in the United States. We saw the first patient, and then as he interacted in his religious group, folk and a couple of community events over the weekend, we went from 1 case to 100 cases, 100 cases, 1,000 cases, and now Westchester is on national news as the center for COVID in the Northeast. So from that point forward, we've been operating without a roadmap. And what we're trying to do every day is deal with the things that are before us in terms of trying to control the contagion. Curve spiked very, very high during the month of March. And at the time, things got canceled St. Patrick's Day parades, just almost within a day or 2 or 3 in advance of them, because that all of a sudden could spread the virus. The governor stepped in. We shut down the schools. We did certain things within our authority. Governor stepped in and he took authority to shut down most businesses and a host of different social things. And religious issues, bang, everything changed. So we went through the peak of this in late March, early April. We had at one point 1,200 people hospitalized for COVID. We have about 70 now. We went through about 12,000 active cases of COVID. We have about 450 now. We, at one point after a week or 2 of this, we were starting to lose fatalities, 35 people at night, 45 people the next night, an incredible amount of death in the civilian situation. Now, of course, we're down to losing an individual. Last night we had no deaths. The night before that we had 1 death. Every death's a tragedy, but you lose 5 folk a night. It's like unbelievable. We couldn't even handle, I hate to say this, but we couldn't even handle the fatalities between our funeral homes and our burial spots and what have you. So we were having to deal with things that are just ghoulish to even talk about. So we're in a better place now because in this area, the contagion has receded. We have lost 1,400 people. It's been disproportionately old people. 85% of all the people that died from COVID are 60 years of age and older. That doesn't mean we didn't lose some younger people, but the bulk of them we lost who were older. We lost disproportionately folk who are African-American and folks who are Latinx, proportionate to their percentage of the society. If there is, whatever the number is, 15% of the county's African-American, we lost a higher percentage of those who died that were African-American. And again, mostly the old category, those who are older. And since I'm in that category, in my late 60s, I'm in that cohort. We were able to, by shutting down the economy, get a handle on this thing. and we slowed all these ratios down. But the shutdown of the economy has been devastating. We have individuals unemployed, people are hourly workers, restaurant industry, bank, no job, people in the gig economy, no job. Small businesses, mom and pop stores can't pay their monthly rent or mortgage payment, bang. Even big businesses are affected. You look at institutions like the Rytown Hilton and the Ritz-Carlton, big upscale places, not enough business closed their doors, and some of them may not open for a while. We don't know what's going to happen. That's big business, not little ones. We know the mom and pops were hurt. The governments have a loss of revenue that is nothing like we've ever seen in the history of Westchester County before. We're trying to figure out how to balance a budget that now has a lack of revenue that's significant. And by the way, we don't know if there's going to be a second spike or not. We hear about it. We can't be sure. We're not medical scientists, you know. So we're hopeful that as we start to reopen society a little bit here, a little bit there, we're moving back carefully. We're opening pools because people are going to be hot and they're not going to want to, sit in the living room of their apartment. So we're trying to figure out how do we provide that respite. We're opening Wilson Woods this week, and that's the one I went to when I was a kid in Mount Vernon. And yet we are concerned that something could spike again. And if we have to shut things down that we've just opened up, we're heading for the second Great Depression. I mean, that's what this is going to be like. This is going to be something people are going to talk about 100 years from now and say the first Great Depression of the 1920s, the second Great Depression of the 2020s. So, AJ, we're trying to figure it out as we go along. There's a host of things we'll probably talk about during this period of time. We know that we're going to have an explosion of eviction issues, so we're trying to heavy up on our support for people who may face eviction, poor people, obviously. We've invested $3 million in additional food distribution because we know we've got food insecurity. We normally have X 100,000 people in Westchester that don't have adequate food. That number has swollen because of the unemployment and all that stuff. So we have to we are trying to do something in that category. The bus system, as we speak, has been free for the last 2 months. If you don't have a car, you need the bus system to get from point A to point B. You're not being charged to use the bus system. That can't go on forever, but we understand they need a break. If they need mass transit, they need a break. And there's many more things that we have to do, but this is no roadmap. There's nothing. I can't go back and look and say, in 1957, when this last happened, this is what we did. This is you and me figuring it out and trying to figure out what's the best thing to do.
So let me ask you, when you were talking, now we've seen, are you paying attention to other areas that thought they were okay and then they started to open up and now they're having to close again? Are you putting that in the scenario of now you're opening up, how you're handling it?
We're watching what's happening, in other parts of the country, the same way we all are. A couple of things apply. First of all, when it hit us hard first, and then it was us, but then it became the New York metropolitan area. It became big cities. The city of Detroit got hit. The city of New Orleans got hit. Philadelphia, what have you. And then mostly northeastern states, Connecticut, New Jersey, Massachusetts, Michigan were harder hit states. At that point in time, a lot of the South and the West took the attitude, well, it's because you're a high concentration of population. It ain't coming here to Kansas. It ain't coming here to, I remember the guy who's the governor of Mississippi said, we ain't China, okay? Meaning China got hit hard, Mississippi's not gonna get hard. Well, guess what? This disease is now everywhere. The difference is that we went through maybe a couple of weeks where we couldn't believe exactly what was happening, and we didn't immediately shut things down because we're trying to assess. But we started shutting things down. The governor certainly stepped in and said, well, I'm doing this across the board. And we've been doing certain things. But we started shutting it down pretty quickly, and we didn't get hung up. Start wearing masks. Candidly, I don't like wearing a mask. I don't like socially distancing. And I was a salesman, marketing guy before I was in public office. We don't socially distance. We greet people warmly, hug people. And all that had to change within our society. You have folk in other part of the country that think this is a political statement, that somehow we're trying to mind control a person because we're asking you to wear a mask. No, I wear a mask, so if we're in the same room and I cough or sneeze or even talk, you don't get what I've got. That's the reason for it. We did it in this area early. So in some of those other places, they resisted it. They had bars opening in Dallas, Texas, and look, I know bars, sports bars, have a good time. I understand what the moment is, but you couldn't have that moment. So now they're finding out what we found out a while ago, but we acted faster. They reacted slower to it because philosophically, they didn't want to do these things. We didn't either, but we did it because we're coming from a different mindset.
And they were listening to the idiot in the White House too. So.
Well, yeah, he's telling them, don't worry about it. Everything's going to be fine. We're going to be ready for Easter Sunday. Look, I'm Christian. Church on Easter Sunday. I don't really want to be in church on Good Friday, but Good Friday goes with Easter. It's a combination event. Right. Repent and then be saved. But the upshot of it is that not to have an Easter Sunday is hard. Not to have a Passover for our Jewish friends, Ramadan for our Muslim friends. Right. We sacrifice those things. And in other parts of the country, they're saying we don't have to do this. So now they're having it harder. What makes the problem a problem for us now is that folk go to Florida, folk go to Texas, one of these other states. Now they come back to New York. I'm not saying don't come to New York, but you come here, you're exposed to the disease, you come back here, now you're going to restart the engine of our disease. So the governor says, hey, if you're from one of these states, when you come here, you better isolate for 14 days. Right. Nobody wants to isolate for 14 days. And Matt can say, oh, it's not me. And then you go and spread the disease. Now we're going to have another round of infection, another round of problems. So much of that are the decisions that the governor is making, but we're taking the attitude that you must use common sense. And we got some people, and I hate to say it because it's going to sound like an old guy picking on young guys. I was 18, 19, 20. You were too. Social time, feeling good, high school graduation year, kids you grew up with, never gonna see them again, party on, But that stuff spreads the disease if you don't show diligence. And then you do have these philosophical people. It's a small percentage in this area, but it still exists, where they just won't do it. And so now we have to figure out how to have this stuff enforced. And we're at a moment, which we're all involved in, where we're looking at police reinvention and reform. And we want police to show a different kind of reaction to folk. And at the same time saying, listen, we got to be careful now. You talk to the people nicely, but you're going into a situation where somebody says, I'm not wearing that mask, make me. So this couldn't happen this disease couldn't happen at a worse time to figure out how to deal with it day to day.
I want to say one thing real quick, and I should have started off with this. I want to commend you start with the lack of leadership from the top, from the federal, from the White House. The governor and you have shown a certain level of leadership that, especially when you see the lack at the White House, you appreciate it even more when you see it on the local level. So you and the governor have been, and I really wasn't a fan of the governor. As a person, as a politician before this, and I have to give him his props. Your briefings, he did it for the state, he did it for the county. Then some of the mayors did it for their. But we had more of a leadership, a great example of leadership, and I want to commend you for how you handled it and been forthcoming with information for the people. You've had the briefings, and you talked about the stuff you ain't want to talk about, but you put it out there, and that's what we needed. And then I think that's and I just wanted to say as a joke, it's funny, all those states that are complaining that we say they need to quarantine when they come here, those are the states that we're saying, oh, if you come from New York, you got to quarantine before you come here.
You betcha. They didn't want these New Yorkers to come down. Right. We're a divided country. We know it. It's no big surprise. I think right now we have to do the right thing. I don't wish any ill on fellow Americans that are in Texas or Mississippi. I've traveled the country in my business years and so forth. There's a lot of resentment for New York out there. They resent us for lots of different reasons. No reason to go into it now. But they're going through now. And the question is, will they learn from our lesson, and will we maintain the diligence that we have to maintain going forward? But thanks for the compliment. I'm going to share with Ken Jenkins, Deputy County Executive, the rest of our team. We got a good group of folk. But I'll tell you this much, and you know from our private conversations, I feel this way. You elect somebody to office, you're not electing a genius or a brainiac. I wasn't born of a royal heritage to be county executive. We are regular people who are trying to make intelligent decisions. We've made some mistakes, and we try to catch them, and we try to fix them. And we're not going to double down on stupidity. If we do something to say, hey, that didn't work, we got to stop it, and we got to reverse it, and we can't be prideful about it. We just have to say, okay, we learned something here, and now this is the way we're going to go forward. And I think that's what's missing in Washington, this stubborn unwillingness to look at reality when it stares you in the face. Frankly, I don't get that, but whatever.
Well, George, was it a challenge or was it easy to coordinate? Because a lot of people don't understand the coordination that the county has to do with the different municipalities in dealing with the COVID. Was it a challenge or was it an easy transition to make sure that the 43 municipalities was in line with what the county was doing and what the state was doing?
You know, Damon, what we did when I first came into office, and I put a priority on this because, you know, you guys know that I've had all these different positions, couldn't hold the job straight. I was a councilman in my home community. I was a county legislator, chaired the board, went to both houses of the state legislature before this gig. So I have a sense of each of these different entities. We started municipal calls originally 3 times a week. We just had one before I started this one, where we get all the municipal officials on the phone. And we don't run it just like, here's the orders from the county. It's a give and take, put a little humor in there because we are people that know each other and work together. We're all in this together. Legislative delegation, work with lobbying the governor on different things. I had started the administration by going out to every single municipal governor. There's 45 of them. And I took the first year of office and I went to the town board meeting of North Salem, the city council of Mount Vernon, the village meeting of Pelham Manor, every single one of them, to go before them. I'm the county executive, the mountain coming to Mohammed, so to speak. And I'm saying we want to work together. We create a good neighbor policy. And when we did it, it was general, kind of let's work together, be nice, play nice in the sandbox. And what it's turned into is in a moment of crisis, we have some credibility. And the credibility isn't, oh, he's a nice guy, but we've now worked together to resolve some issues. We're working with Mount Vernon on Memorial Field, and we're taking on the responsibility to fix it so that Mount Vernon has the field fixed. And if it's going to get done in my term or not, we're working on it. It's going to get done one way or the other. We took on the responsibility of the New Rochelle Family Court. We didn't let it linger. The current court is unacceptable for the people that are going into the court. Now we're going to have a new building and it all worked out. So when you do those things, Damon, then when you come back and you say, okay, now we have to work together on this cooperative effort, you have a much more responsible group of people. Not everybody is there, but the vast majority of folk are there. And it's also, I think, the style and the attitude. If you don't act like you think you're somebody special, then you can work through with people. If you come in like, look at me, I'm great, people don't go for that. And you're not going to get accomplished things that you want to get accomplished.
Right. AJ, you got a question? Or?
No, go ahead.
So dealing with the COVID, there's a lot of different rumors with employees and how they, when they are affected and getting and coming off payroll. Is the basis from the health department how the county makes the decision, or is it based on different departments or different department heads and how that decision is made?
Well, to the greater extent, we've tried to operate within a certain set of rules, but let the department heads manage their departments. It's a bit of a different strategy than my immediate predecessors, who tightly controlled everything from the 9th floor. I've always believed you treat men and women like grown-ups, and if you have the right people, you let them administer their departments. You get some differences between Department A and Department B because of the personalities, but then again, the person in the planning department who's drawing maps for drainage is doing something very different from a person who's in probation, going into a community to deal with a parolee to discuss, what they're doing for the day. So there are people who do this and there are people who do that, and they're all on a different level. What we've tried to do, I think the first most important thing we've tried to do with the workforce, and I hope we've done it, I think we've done it, but it's up to the individual. We've tried to treat the workforce with respect. The first chance I had to show that, my first week in office, we had a pretty bad snowstorm, and I closed the county government. And I've been told that many times in the past, we did not close the county government. And from corrections, there is a cost factor when you close something because correction officials have to go no matter what. And you wind up spending more payroll money when you close the county. You're not going to close one department or leave one department open. You're going to close the county. And I said, I can't live with myself if some county employee driving home spins out on an icy road and dies. So I'm going to keep those people home. And if it keeps an extra amount of money that we're going to have to pay for them, we're going to pay the extra amount of money. We saw that when we shut the county down for Juneteenth, 2 weeks ago, I guess it was. We knew that that was the right thing to do given the moment. And if there was a cost factor to it, and there was a little bit, it wasn't terrible, but some would say, well, no. It's a matter of respect. Shut the county down for Juneteenth. So what's the message? The message is we actually care about the employees. Now, I can't say every department head operates the same way other department does, but if a person, that's a nice way to put it, huh? But, when somebody catches COVID, our attitude is, okay, you got to do the right thing. You got to quarantine, and you got to go 14 days. And initially, you had to test negative to get back to work. Then they changed the rules, and they said, if you've done 14 days, you're good, you come back. But we never laid anybody off. We never cut anybody's salary. We basically said, this is like getting COVID is like being sick. And, you didn't get sick on purpose. You didn't catch COVID on purpose. So we're going to try to deal with you as a member of our family. And when you're healthy, you come back to work. Now, there are individuals and there are individual conflicts in different places. So what I've just said is the general rule, and you can point out some exceptions to the general rule. But I think that was the right way to play it. And now, whenever we decide to talk about it in this conversation, when we talk about the voluntary severance program that we've instituted to allow some folk to leave if they want to do that, to try to reduce the debt that we have, I'd like to think that most of the workforce feels this is not just shoving you out of the door. This is different from laying people off or furloughs where you lose a certain amount of money. That's what some other counties are doing. I checked with some of my fellow county executives, and a couple of them said, well, why are you doing that? Just lay them off. I said, A, it's bad for the economy. B, it sends the wrong message. We're trying to get this workforce to feel like they can produce their work at a high level, and they're not going to feel that. And, what we had for, prior to my coming on board, we felt we had to reestablish some relationship. And we're still to the test every day. Nobody's like, yeah, we trust you, but let's see what happens on the next time we interact with you. And so we want to try to build on that. And so the way we handle people on COVID, hopefully is consistent with the way we handle people in a snowstorm, the way we handle people when other crises come up. Hopefully we're doing the right thing.
Right. As a small business owner of Black Westchester, and I've got a couple of calls, businesses. I know there was some grants from the government, from the federal government. I know there was something from the state. Was there anything on the county level to help small businesses? Whether it be a grant or, because people are asking who they call. And some people said they actually called and talked to somebody that was supposed to help them and didn't help them. So if you could speak on that process.
Well, we asked for authority from the state 3 or 4 months ago to use our IDA, Industrial Development Agency at the county, where we have a certain amount of money in account, to create a grant and loan program for small businesses. And we needed the authority to do it. We just got that authority, I want to say 10 days ago, something like that. We announced this publicly a week ago, slightly more than a week ago. I forget exactly when we announced it. And now we're in a position to offer, these are small grants, grant of $10,000, loan of I think 20 or 25,000 to help out small business. You have to have a certain size or less of employees to be able to do that. That just happened. If we'd have gotten the authority to do it 2 months ago, we would have started it 2 months ago. Bridget Gibbons is our Director of Economic Development, 995-2900. AJ, you know somebody, give them the number. Damon as well, have them call Bridget. And we have an effort being made specifically to help business owners and people of color. Sometimes when we've gone to bat for people, it hasn't been strictly governmental authority. We know that I don't want to specify a name, but there was an African-American store owner in Bronxville that had some issues with her landlord.
We covered that story, yes.
Yeah, so we tried to be helpful in that process. We're not the court, so we couldn't order something. But where we see an opportunity, we try to step in and be helpful. And I think this small grant program, now that we've just launched it, there's an application period. It's still open. And if you want to get some information, we'll communicate back with you after this. I'm going to ask Emily Lavin from my communications team to get you both information specifically on this so you can share it. And we encourage small business owners to use this if this is helpful. And I'm sure a small business person is trying to piece it together. Do a bit of this, a little bit of that, take this, add this together, and this will get me through it. And we're all hoping that, we'll be able to.
What
store.
what would you have to be to qualify? Like, we're small.
I don't. Off the top of my head, I don't know the size of the company that applies. It is quote unquote small business, and I think we have either an employee threshold or a revenue threshold. But it's targeted for the old traditional mom and pop businesses.
Mm-hmm.
I'm thinking of the person that I'm thinking of in Bronxville. I'm thinking of a store down in Mount Vernon that I visited last year when they were having some issues. It's a store. She's too young to be my mom or pop, but those kinds of businesses that are have a small profit margin. They're just trying to get through. They want to keep the doors open, keep somebody employed. Right. That's who we're targeting. But there's a whole thing that goes with it, and I don't have it in front of me, so I can't explain it perfectly well. But as I said, Emily Lavin will get the information to you. And then when you look at it, and if there's anybody have any questions, they can call Bridget Gibbons, and she'll be happy to explain it. Back when they had the beginning of the PPP program at the federal government, or the EIDL loan program, EIDL, Bridget got together a group of volunteers that could help businesses apply for it. Because, you had a mom and a pop business. Maybe you have one or two other employees, and we throw you a 30-page application to get help. And they look like, how am I going to do that? So we had people available to help you do that. But that wasn't money. This is money.
Okay. So back when we was, you had spoke about the buyout and allowing people, how is that going to be structured? Because there's a good number of people with 20 years, 25, 30, that's working for the county now.
Yep.
So how it would be structured as an incentive, for some of them to retire?
So the first thing, Damon, we were waiting as long as we could to see if the state was going to do an early retirement program, because the state has obviously more power than the county. And if it crafted a program, the last one was done under Governor David Patterson back 10 years ago. State did a buyout program. They could add retirement credit to it as well. Right. So you're at year 19 and you're a year short of vesting, they could give you that as part of the buyout, more lucrative to you. We did one. I obviously wasn't in the county government in 2010. I was actually in the state government. When they did that buyout, it came right after Westchester did something similar, voluntary severance. You had two of them side by side. And the state program was better than the county program. If you were going to take it, you take the state option, and the county at that time made either one available to you. So we were holding off because we thought, hey, if the state comes through and does this, fine. But it became apparent to us, we talked to the relevant people, that there wasn't a temperature at the state to do it, so we knew we had to launch off. The program is not that complicated, and it does track what we did in 2010 and in 2015. For every full year of service that you have in county government, you're eligible for $1,000 as a severance piece. So if you, for 18 years, $18,000. If you work for 25 years, $25,000. We put no cap on this program. In 2010 and 2015, they had caps. You couldn't go above 30,000. If you have 33 years in the county, we will give you $33,000. We also created something that didn't exist in the prior offer, which bridges you if you're a year or 2 years away from 20 years in. You would be just short for your medical coverage. And we will work out a severance payment that will cover your medical for those 2 years so that you get to the 20 year and then you get the medical benefit, because we know medical issues are extremely expensive for folks. Right. And we want to try to bridge that. So that is also part of this deal. And there is a cap if you do, there's an expectation that you won't come back to county government for 5 years. And then after that, if you do, there's a limit to how much you can make if you come back, consultant and all that kind of stuff, because we frankly, we don't want somebody to game the system. And, some folk do know how to game the system, and they will. Right now, it's not that we want people to leave. We're just facing this huge $180 to $250 million gap. We've got about $60 million off of those numbers, so we're probably sitting now around 120 on the low end to 190 on the upper end. Now, that presumes we don't have a second spike. If we get a second spike, all bets are off. It's like, baseball's going back, unless the second spike happens. And it happens, and that's that. But we still have a gap to try to deal with. And the next year's budget looks very problematic because we don't know if there's going to be any coronavirus money. Frankly, it's going to depend, bluntly, on who wins the election. If the Democrats are in charge of the Senate, the House, and the presidency, that's one thing next year. If Mitch McConnell holds on to the Senate with Donald Trump, that's another thing. And, they haven't given any indication they're going to be helpful to local governments at this point. So, we face a different set of circumstances doing the 21 budget. But as it stands now, $1,000 for every year of service. You have to register that you're going to take this by July 24th. Now, that's kind of a narrow window. It's 3 weeks. We announced it yesterday. We sent a mailing out to all the relevant employees. And I did a little video to go with it to try to explain it. People are now talking to the union. They're talking to the HR person. And they're talking about it over coffee at home with the wife, the husband, the girlfriend, hopefully not both, and discussing, does this make sense for us? And it makes sense for some people. You're close to retirement. It may make sense for you. You're the second income of a family, and the first income of the family says, listen, don't worry about it. Take the money now, and then look for another job, and you'll find one or whatever. Somebody says, hey, if I get a lump sum enough, I'm going to start that business that I wanted to start. It would work for that person. Whoever it works for, I don't know. But each person will make that decision. Now, to the county's benefit, if you're making $100,000 a year and you get a payout of $20,000, which we have to pay this year, but you leave the employment for 5/12 of the year, we don't have to pay you 5/12 of the $100,000, and that saves us a certain amount of money. And then the $20,000 that we paid you comes off of that. And what's the net? And the net savings to the county is some number. And
right.
Next year, we start the year without someone in that position. Now, the job may be essential. We may need to have somebody in that position, but we may say, okay, let's run to the end of the year without filling the job. Let's run 1/4 of next year without filling the job. So if it's a $100,000 a year job, we'll fill it by the beginning of the first quarter. So we'll save 25 on the 100,000, which will cut us a break. And then the person starts after that. Maybe the person that's leaving at 100,000 is step 5, and the entry level step 1 is 90,000. So we save 10 on that, and you piece it together in terms of what the savings is. And then if we can do that, and we don't have to lay anybody off, or we don't have to furlough anybody, then we're saying to folks who stay, your revenue is not compromised. We got this through the people that were prepared to do it voluntary.
Right.
Now, 2 problems, and Damon, one of them right off the back is your correction guy. We can't not fill a correction position. If the state says you have to have X number of slots, we have to have X number of slots. So we did not offer this to the correction folk, because if Joe Smith takes it and goes, we have to fill Joe Smith's spot right away. And therefore, there's no savings to the county. So we were unable, and this is the same thing that happened in 2010 and 2015, we're not able to offer to correction officials. We certainly don't offer to elected officials. Police is in the same boat, a little bit different, but with the police situation, the police management and police union wants to fill these slots right away. They don't want to have a downside. The planning department commissioner doesn't come to me and say, I got to have 25 people no matter what. Take 3 away, you got to fill the next 3. It works differently in the law enforcement grouping. So it's offered out to CSEA, Teamsters, nurses, those are 3 unions, and the non-represented management of the county. And we'll see what kind of takers we have. We have a certain amount. Whatever we have, we have. If only 2 people take it, 2 people take it. If 200 people take it, we can't run the government if we have certain positions going to that many people. So then we'll have to decide, okay, we'll run and we'll hire the person in the new year, or we'll hire them 3 months into the new year. That'll be that much of savings. And that's how it's constructed. And now we'll see how folk feel. They have about a little over 3 weeks to think about it, and then register, because we need them to be off the payroll by August 1st if this thing's going to work financially.
Mm-hmm.
Okay.
I forgot what I was going to say when you said, but
well, I was going to. Okay.
I just remembered. Is there anything in the works with the state, because all correctional facilities population are dramatically low, right? Especially county jails with the bail reform. Is there something in the works to negotiate with state that they have to lower these numbers because the population is not matching the actual beds?
Right.
That the state says that we have to have certain amount of officers for every bed.
Right, and we've asked the state, in a general way, to look at this issue for 2 reasons. Number one, that's because we were trying to cost control, and if they could give us that leverage, then we would offer it to the correction officials.
Right.
make those decisions. The second thing is we've gone through, number one, releasing a certain amount of population because of the new bail laws. Mm-hmm. Folk in the county jail that now were not under those laws to be held. So we released those folk. And then later on, with the COVID situation, we released some folk who were not violent criminals, who could be argued that by staying in prison, you were more likely to get COVID rather than less likely, and we released some other people. So our bed count, as you know, it's 1,800 bed facility. Our number count is down, fairly dramatically. And again, it's not like we're looking to get rid of people, but if the person decides that this is right for them, let's make that the option for them. But we haven't yet gotten the green light from the state that this would be the case. If they can open that door for us, then we can revisit it. And depending on what happens, we could, in theory, reopen that opportunity. But I'm very proud of what we're doing in the correctional facilities. We've talked about that in the advocacy group that you've been involved in. We've made some nice strides there. I think our management team and the workforce in the corrections component, as in the probation department, is diverse. It's not perfect. We can make improvements. I think some strides have been made there that are good. And, I want to make sure that whatever we do, we're working off of this creativity that I have seen displayed. There's college credits you can get if you're in the county, jail. There's certainly high school GED you can get if you're in the county jail. Culinary arts certificate that would help you when you go out, get a job. We made the decision independently, and I credit this to the advocacy group that you're a part of. We banned the box on applications so that you don't have to check off the box and say if you've ever been arrested or anything. So if you put an application in AJ and you've had some run-in with the law at some point in time in your life, you check that box in your application, and that application ain't never getting to the level of an interview. And that came from the advocacy group. That was like first day was one of the things that they advocated. And then we did it internally by executive order, and then we passed a law to do it all across Westchester County. So there are things that we can keep doing along those lines that I think will make some effect. But as we start to talk about the policing, it's pretty clear that, I think we've had some good things in force in our police force, body cams for the patrol. There is some implicit bias training going on. We don't have as diverse a workforce in the police as we do in the corrections and the probation. And we've got work ahead of us. And I'm not satisfied by it. As I've said many times, we've talked about this thing. We're making progress in different ways, but I'm not satisfied. And I'm not surprised when other people are not satisfied. When they come to me and say, hey, how about this? And I say, right, working on it. We've got to get there. And I know, assuming I do run for re-election, I'm going to be held accountable on that day compared to some other people, whoever's running against me. Do you think that person would do a better job of these things than I would? But I'm going to be held accountable, and I accept it. That's what politics is.
Yeah. Let me ask you. So with the closing, with the bail reform and everything. So now you have less people in there. Is the county? You said these services like getting your GED and stuff like that, people got in while they were in jail. Now that you have less people going in, are we putting services for the community, to be able to get that outside of the jail? Like, are we using,
Yeah. I don't know exactly the correlation of all of the external services that are available. We'd have to go back through our probation function to determine how that works. And I would suspect, AJ, we could do more. I don't know that we're on the other side of the mountain doing the same things that we're doing when you're inside, the institution. So I would have to check at that, look at that. I would put that, Damon, on our agenda for the activist group that we talk about. Although we're going to be talking about a lot of police stuff, that we should talk about that from the probation side and what are we doing there. We contract with a lot of not-for-profits, and my natural tendency would be to look for not-for-profits, either ones that we're helping out now or ones that exist, and then contract with an organization that functions in the Mount Vernons, the Yonkers, the Peekskills, that could provide some of those services. So it's not us doing it, but us making sure it's being done in the community. I suspect that those entities exist, whether they exist at a large enough level to accommodate that. But the whole mission is when a person, leaves the system and goes back out in the community, we don't want them back. I don't want them back. I want them to have a productive life. I want them to, find that way of their own to go forward and then be successful in life. And I grew up in a neighborhood. I had a couple of friends of mine wound up inside the system, and then I've seen them later in life. And how'd you do? He says, man, I did that thing, boosted the car. I shouldn't have done it. But I'm okay. Here I'm at, married, got this, I'm doing that. And you feel good. You feel like, yes, we're through this experience in our life and we're heading in the right direction. So, yeah, I think we could do more to help folk through that situation. And, of course, there's a larger issue, and I don't know that just the county government can handle this. When you deal with institutional racism, when you deal with the difficulty of people who are even qualified to get a job and they can't get the job and they can't support their family through the proper means, and then around them are influences to head back in the direction of that behavior, we need more than just what a county government can do for that. We need the federal government to step in and be able to put resources into that. And if we get a different government that's prepared to do that, then we can be a partner to them in doing that. And we need more affordable housing, high on our list before this stuff happened. We need places where a person can say, yes, this is, these are my children and my wife, whatever. We can have a decent place to live, and then out of that can grow other things.
Right. Yeah, and I especially ask that question because, places like Mount Vernon and Yonkers have been dumping grounds for the county. And Mount Vernon specifically keeps getting stripped of resources and services. Like they closed the probation office in Mount Vernon, but then they expanded it in Peekskill. You know what I mean? And just down the line, they just keep cutting services, but they keep giving their undesirables, their homeless, their whatever, to Mount Vernon. And Yonkers too. Yonkers is becoming, I know I've heard complain that Yonkers is becoming a dumping ground too. So that's very important. We need to be looking at these things that are in place to help people stay out of jail. The reasons that they had to do some of the things to that ended them up in jail because they felt they had no other options. You know what I'm saying? So
I do. Well, keep in mind that many of those services that were closed happened prior to my tenure.
Absolutely, yes.
We have tried to reestablish a couple of those things as we can. Obviously, dollars and cents are always part of the equation. And frankly, we thought that we were on the right path after we got some additional revenue to start to do more of these programs going forward. Then COVID hit, and I could sit around and cry like the president does. He had this big, beautiful economy is going to run all that, and then it didn't happen. So you got to grow up and just deal with what's been given to you. But we had a lot of plans, and some of which we're still working on. We're going to put a serious effort of money behind food distribution. We're putting serious money behind eviction prevention. And then, somebody would say to me in an advocacy group, we just had this happen a couple of nights ago from one of the Latinx groups. They say, well, you got to help us not pay rent. I said, dude, the county government does not have the resources to do that. And he said, well, New York City's doing it. Well, New York City has income tax, government this big. The state needs to do that. And it looks like I'm passing the buck, but I'm just being realistic. I'm going from a county government that got out of things, and now I have to reestablish that. And then now looking at, and the need is there. I get the need. Way once upon a time ago, when I was a kid, I managed a Section 8 program in the city of Mount Vernon. I was 23, 24 years old, had my master's degree in public administration, grew up in the neighborhood, South Side boy, go help people find housing. And man, oh man, was it difficult then, 40 some odd, almost 45 years ago. So it's worse now. And I get that. And the pressures in the neighborhood are worse now than they were. And there's drugs around this corner, and that's worse now than it ever was in my day. So I get that there's the problem. Now the question is, how much of that stuff can we do? And within Mount Vernon and within Yonkers, there is a sense that if you go back into the community, you go back into a community that is weakened. You look at the COVID thing. What did it point out? That our healthcare system is not robust. You get the Mount Vernon Hospital is closed. That's the hospital.
That's why I wanted to bring that up too. People have asked that question about that.
Yeah, no, look, the county can't reopen the hospital. We could put certain services, a couple of services in there, but it's really the state that has to step forward and dialogue with Montefiore to say, hey man, that can't close. Because look, we needed every one of those bedrooms when this thing hit. needed the hospital rooms in order to satisfy what the peak was. And although the peak never got to the point countywide where it exceeded the amount of hospital beds we had, we needed to have those beds available just in case. And if we get a second spike, which is bigger than the first spike, which is what happened 100 years ago when they had the pandemic of 19, whatever that was. The second spike was worse than the first. If that happens, and we need those hospital beds, we can't afford, Mount Vernon Hospital to be the assisted living facility. It's gotta be a hospital in the middle of an urban need station. Now, I recognize that the economics of a hospital like that are compromised. You have folk who are primarily with Medicaid. You're not getting enough discretionary services. People aren't going there for plastic surgery, pay a whole hell of a lot of money for that, or elective surgery is the word I was looking for, not discretionary. Elective surgery, and that's where the profit is in healthcare and so forth. But it doesn't matter. It's a city of 60 some odd thousand, 70,000 people, and you need to have it as a community institution. So what do we find? We found that when COVID hit, we didn't have the infrastructure in the poorest neighborhoods. Why? Because if you were living in a wealthy community and the guy said, well, you got a social distance, so you go into your 4-bedroom house with 3 bathrooms, and this bathroom and this bedroom is where you're gonna isolate from the rest of your family. In an apartment with 2 rooms or 3 rooms in a building with 88 other apartments, you're not going to be able to do the same thing. Where's your health care? Well, I'm going to walk a mile and a half up 4th Street to go to the neighborhood health center, and that's my insurance. That's a whole lot different from a guy getting in a car and driving to his medical professional at West Med, different thing. And we realize what the weaknesses of it is. The county has a role to play in those things. We once upon a time used to support neighborhood health centers with direct money. We haven't done that. That got discontinued under the predecessor to me. And I think we have to reestablish financial support of those institutions, but it comes a time when other things are all, it's priorities like everywhere you look. We got to do this, we got to do that, this, that. But we need the better health infrastructure for people of color, because, you're dealing with problems that if you can't deal with in the preventative stage, the expansive stage becomes way more expensive and you lose life. And we can't afford that to happen. That's what happened with COVID.
Yeah, I think it's a wake-up call for everybody that we have to address preventive when dealing with health, and also when the statistics came out, and I think it was a great time to talk about chronic illness in the African American communities, because we don't have that conversation enough about preventing heart disease, high blood pressure, high cholesterol, diabetes. All these issues that came up around the COVID crisis, that there were problems in Black and brown communities throughout the United States in dealing with these chronic diseases. And I think it should be moving forward. There should be some way to address that, especially in poor communities, that have lack of health care in the first place. Absolutely.
And when COVID hit, the testing capacity didn't get into the urban centers in walk-up scenarios right away. We originally had in-home testing, which takes forever to do. And then the state established a drive-through at Glen Island, which is great. Now everybody has a car. And they had a long backup line and people couldn't get on the line for COVID testing. Well, while you may have it, you haven't been tested and you're in close quarters in an apartment building with a bunch of other people who's getting infected. And all of that was the deficiency that we had. Now, in time, and credit Andrea Stewart Cousins, because she was like a tiger in making sure the state established centers in urban Yonkers, urban Mount Vernon, Peekskill, and other places, but it wasn't there day one. So anyway, I have a feeling no matter how long I'm in this job, it could end next year, it might end another 4 years after that, whatever. There's going to be undone things the day I walk out of this office. I'm in my office right now. And probably, when I see you guys out in the street after my tenure's over, I'm going to say, not what I did do, I'm going to think about what I didn't get done during these years. The hope is that we establish a progress so that if I'm the 9th county executive, there'll be a 10th, and there'll be an 11th county executive, and we advance this thing. We lay groundwork, we go this far, And if by the time I walk out the door, we don't get far enough, then the next person takes it to the next level. And we see the progress on a straight line, because it's going to take time to undo things that have been 50 years in the making, 400 years in the making. But we just have to be showing energy, direction, and progress on each of those different areas. And as badly as we need it tomorrow, we just have to work at it and then see how fast we can get as far as we can go.
We had one listener, and they asked the question earlier, and I didn't actually get to it.
Yep.
Jeff Monroe, he was like, has the county exec actually advocated to the state about the importance and the need of saving Mount Vernon Hospital?
Yes. Yeah, we have communicated that. I had a detailed conversation with Gary Pretlow, a longtime friend of mine who's the assemblyman for Mount Vernon. I must have signed on to an email with something at the time that he was trying to show public support for it. And I indicated to him whatever he thought I could do. We are not, as a county government, a direct decision maker in the process, but we indicated that we would be willing to do some portion of cooperative effort as part of an overall plan to save the hospital. And, that could mean any number of different things. We could park some county function in the hospital complex and, pay rent for that. So it's a revenue stream, do something. But yes, we're in favor of the saving of Mount Vernon Hospital. As I said, I was born in that hospital. I was hospitalized there twice in my life, once when they took out my tonsils and once when they fixed a broken wrist. And, that physical building is a sign of the importance of the community, that you have a hospital in that community. And by the way, I live right near where United Hospital is, and I was in there once. And United Hospital was a defining feature of Portchester. The building is still standing 15 years. It's deteriorated so much that we couldn't use it to reestablish it as a hospital during COVID. We took a look at it right away, and the building department said, not habitable. That's what happened. And it stands almost like a monument to neglect. In fact, a kid died getting on there. Kids are, I did it too. You get into a place, you start to fool around. Kid died there, fell inside the building. So I've seen what happens when you have a valid hospital that served a community, and Portchester is a Latinx community more than a Black community. There's an African-American community. It's a poor community, hospital closed, and it's standing there like a monument for 15 years to nothing. I don't want to see that on North 6th Avenue.
Angela Ferris says, as the executive director of the New Rochelle Housing Authority, real affordable housing is critical as public housing is transitioning.
It is. And of course, affordable housing is one of the priorities, I think, of this administration. We follow an administration that did what it needed to do to satisfy a lawsuit settlement that they fought vigorously over their tenure. They did not want to settle, and finally the court made them do something. So they've done 750 more units of affordable housing in targeted communities. New Rochelle was not one of those targeted communities, because New Rochelle had met certain goals and so forth. We come into office and we think affordable housing is needed everywhere for all different levels of entities. And we need to get a commitment for affordable units when we do market rate housing. We need to have some standalone affordable housing where the building in its entirety is affordable. In New Rochelle, there's a site on Garden Street right opposite where we're building the building that's going to house the New Rochelle Family Court, which is going to be affordable housing as an entire building. There are a number of these buildings in downtown New Rochelle that have been negotiated. New Rochelle's made these decisions, but they have argued for a certain number of units of affordable housing. It's not enough, but it's the progress and the push to get in that direction. In Portchester, we're just looking at a 34-unit building that's just about closed out. I think they may have had their lottery thing already as to who gets the units. And they opened up one in Rye. It was targeted to seniors. They opened up affordable housing in Rye a year ago. That was done under the prior administration. It just opened under my administration, so I don't take credit for that one. But we need affordable housing at every turn. And we recognize that affordability now deals with a larger group of people, because a larger group of people have less money.
Mm-hmm.
and when you say, okay, it's 80% of average median income, I guess is what the AMI stands for. There's more people now out of work, and we don't know what their prospects for work will be going forward. And so the need now has just exploded because of this pandemic. But
we have another question that says,
yep.
if a correction officer contracted COVID while at work, recovers by the CDC standards and returns to work, and contracts it again and dies, what will be the position from the county to help protect his or her family?
I don't know how to answer that conjecturally. All I could say is that the first thing I'm going to do is call the county attorney and say, what if this and what if that? If the person who asked the question is working off of a case of some sort, then we ought to talk about the specific case. You remember when I was a candidate and I came before you guys and you pointed out the case of an individual who was being poorly treated based on their retirement and so forth. I said, I didn't know how to fix it. I said, but we would work on it if we got into office. And we did, in fact, work on it. I think we got to resolution of it. So I give you basically, AJ, the same answer. The specifics, because it has like, if a person has it and then recovers and then gets it again and die, I'm not really sure. My natural tendency to say is that we would do what is compassionate and humane for somebody who worked for the county government. But that's almost like a BS answer to say. It's what I feel as an answer.
Right.
But specific, we would have to look at the specifics and try to figure out how to help from
there. Are you saying that you are definitely running for re-election? Someone said, I thought you were only one term. I don't know if I've ever heard you say that.
No, here's what I've done. First of all, I have submitted a bill to the county legislature that takes the existing 3-term limit of county executive and reduce it to a 2-term county limit.
Okay.
A maximum of 8 years. Now, the bill would not apply to anybody who has served previously. There are 2 living former county executives. This would not apply to them because their service was prior to this. It would apply to me and would apply to any of my successors. And I don't do this with the legislature. It's just with the county executive. Why? Because the county executive's got a lot of power. And I think history has proven, no matter who that person is, whether I'm the greatest guy in the world or not the greatest guy in the world, nobody should have too much power for too long, because almost invariably, it leads them in the wrong direction. And whereas there's a 12-year limit, I think 8 years is a good limit. We have a limit for president for 8 years, where you have term limits in governors, Governor Jersey, Governor California, Governor Pennsylvania. 8 years is the limit there. I think 8 years is good. So I put that in. I'm obviously serving in my first term. God willing, I complete it. I haven't made a formal announcement or a decision about re-election, but, I'm not playing cutesy-poo with this stuff. I'm energized. I know we're going to accomplish some things before the end of 4 years. I'm probably going to figure that another 4 years would give me the chance to do more with this. If I make a formal announcement, I'll make the formal announcement. But, I'll tell you what, you don't know what's going to happen. And Jack Kennedy was a 46-year-old man
right.
in his 3rd year of the presidency. And what are you going to do, Jack Kennedy? Well, you're going to have breakfast in Fort Worth, and then you're going to go to Dallas. And you don't know squat about what's coming. So later this year, first part of next year, if there's an announcement to make, I'll make it. If I were to serve a second term, that would be it. And by the way, you just saw some Democratic primaries where some folk who've been around for a while got defeated by some new people. What does that tell me? People want change. And when they want change, you should build in some of that change. You should be able to say, just like I said a minute ago, if you know you're the 9th, there's going to be a 10th. Don't act like you're the last one and you're going to keep it forever. So build in the change so that your next county executive could be African-American person, could be a female, could be Latinx. Open that door. And one more parallel in my career. I was county board chairman 20 years ago. I was in my 40s. I'm 66 now. I was 46 then. Prime of my life, I wasn't carrying as much weight as I was carrying now, around my middle. And I had 2 terms as county board chairman. First Democrat ever to chair. We did some good things. And then I didn't seek a 3rd term. Why? Because Lois Bronze was my vice chair, and she deserved the opportunity to be the first woman and the first African-American to serve as chair. I understood that. I understood the time had come for that diversity, and I didn't seek a 3rd term. most people would say, like, "Are you crazy? You'll pop it. Take the third. I'll do things." And I did do other things. And Lois got to make that history statement. Now she's gone. But every little African-American girl will know that there was a Lois Bronze and an Andrea Stewart Cousins who achieved. And if they achieved it, you can achieve it. And at some point in time, you'll see an African-American face in the box that I'm in right now. And that's a good thing for the county and a good thing for America. You'll see a female face in that box. And that's a good thing for the county and a good thing for America. That leadership comes from in any package. It so happens that I'm in the package like everybody else that's ever been in, except that I get it. And I hope I get it. And I feel 2 terms, if it comes that way, is enough. And if the voters decide 1 term is enough, guess what? They're in charge.
I just want to, for a lot of people that don't know, when you came in, George, you actually opened your doors up to community organizations throughout Westchester County to talk about police reform, criminal justice reform. What could you do out of your office to help that reform move forward? And I was out, and I say that because one of my associates, Terry Watson, who's out at Penn State University, he did a forum, and me and a couple other people went out there. And when we told, they had 5 or 6 chiefs of police from around Penn State University. And when I told them, I said, well, we meet with the county exec like once every 3 months. And they were like in awe, that county executive was sitting with communities talking that way and opening up the dialogue. And a lot of people don't know in Westchester that you have done that from day one. And I commend you also for keeping your word and helping the officer get his health care. After 7 years, he was fighting for 7 years to get his health care after being hurt on the job. And you kept it was brought to your attention. You kept your promise. You looked into it, and now he's doing a lot better. I say that to say, with the issue with the George Floyd, and you already being ahead of the game and talking about it. We've been talking about it, and then now you decided to put this panel together. Just let the people that's listening and people that's watching the intentions of the panel to move forward in addressing issues of police reform.
Well, we have created this group, task force, and we initially planned to do it as a response to George Floyd, but we were heading that way because of our informal conversations with the community. Gave us ideas, which we implemented. I just mentioned we got Ban the Box from those dialogues that we had around the table. We created a corrections board and a probation board to parallel the police board, and we filled it with some of the people from around that table and people in the dialogue that we have, and sometimes we get into it, but the dialogue that we have has given us fruit that we can now build off of. So this group now that's been impaneled is co-chaired by Mayo Bartlett and by Leroy Frazier, both of whom African-American, both of whom are lawyers, both of whom had experience as prosecutors. They've been inside the governmental structure. Mayo is a defense lawyer, and he's defended individuals in a lot of breakthrough type cases. And we have around the table, we're happy to have Damon Jones on and Kenneth Chamberlain, who were part of this informal group that we meet with regularly. We have ministers like Reverend Stephen Pogue from Greater Centennial AME Zion in Mount Vernon. We have a woman who's an activist from the LGBT community on the committee. We have folks from the police department. We have the commissioner, deputy commissioner from the county police department, Tom Gleason, Terrence Rayner on it. We have the PBA head for the county police, Michael Hagan, and Chief McNerney, who's now at the DA's office, but was a former Greenberg chief. He's now head of the Police Chiefs Association. We have some other folk who are on it from the Human Rights Commission, Reverend Doris Dalton, on early from Greenberg. It's a big committee. And the work that they're going to do is substantive. There's a meeting coming up this week for the first time. We've had a couple of planning sessions. As I understand it, the two co-chairs are going to break the tasks up into like 6 basic working groups. One is going to be transparency. One is going to be accountability. One is going to be education and training, yada, yada, yada. And in each of those areas, they're going to come up with recommendations for executive action, executive orders, things we can do by executive order, things that we can do by law, and things that would be policies and procedures. And all of this, it will end up in a singular plan that will be submitted to the state based on what the governor has said by April 1st of next year. And we don't get any of this if we don't submit it, but we want to do this.
Right.
And this turns out to be the best way to consolidate things that we've been talking about into a singular format, so it satisfies what the governor has, and it satisfies what we wanted to do anyway in terms of dealing with this. But the George Floyd murder has crystallized things in the society in a way that I have never seen before. And I remember the marches in the late 60s when I was high school, and then into, when there was the Kent State, Jackson State thing. We had marches in Mount Vernon at the time, and but nothing has come together like this has come together. And so this is a moment, and you seize the moment, and you do things that you think are going to be good with a good group of people to work through it. And there's a time frame attached to this thing. This is not, we're going to meet someday in the distant future. By December 31st, we have to have a document done, which is going to be shared with the Board of Legislators. They're going to have to adopt the plan. And I've said to the members, there's 3 members of the Board of Legislators, I forgot to mention, there's 3 members of the Board of Legislature on this committee: Terry Clemens, Lyndon Williams, and Colin Smith. And they are empowered while the discussions are going on. If they see something discrete that they can do legislation on, don't wait for the report, pull it out, get the bill, put it in the county legislature, start working on it. Similarly, if the committee says, we have an executive order, I'll give you one example. Because one of the things we looked at was requirement for how we report a host of different category of activities that break it down by demographics. I looked at that and I said, we're not doing it. I hate to advertise my ignorance. I said, are we not doing that now? And they said, well, we're not doing this directly. I said, well, can't I just order it? They said, yeah, you can do that if you want by executive order. And I said, well, good. We'll have the committee look at this early on and recommend that it be an executive order, and we'll do an executive order. It's not the most important thing to do, but it's an example of something among many things that will come out of this process. So I'm reasonably excited because we got good people in the room. There's going to be arguments in this room. Folk are going to go back and forth with each other. I think it's called democracy. And as long as folk, at the end of the day, my attitude is we can argue, but at the end of the day, we could go out and have a beer, and that's okay with me. As I said to Damon last time I saw him and Kenneth over at a thing in Greenberg, I'll argue with people that are bigger and stronger than with me up to a point. And then at a point, I know when to cool it, because that dude could take me out. So now I'm ready to do the beer and that, or whatever. And that will get us to the point we have to get to.
Right.
I don't want to take up too much more of your time, but I did want to, this came up a couple of times, and one person said, especially if we have a second wave, which I think that we have a continuous first wave, first off. But if we have a second wave and people are shutting in again, is there any consideration to doing like a COVID testing on wheels? Would be great for those who can't go to the testing sites or leave the block, similar to the mobile health vans that was suggested.
That makes a lot of sense, AJ, and I think if I'm going to ask again, Emily Lavin, who's here, write that down so we don't forget it as something to look at. Because if we have a broad-based group of people that are isolated, we need to make it as easy as possible to test it. You should know, though, 27% of the population of Westchester County has been tested for COVID already. There is no jurisdiction that I know of that can say that 27% of their population, and we're going to hit 30% probably by the middle of next week. That is, and 33% maybe within the week, maybe a week from today. That's a tremendous amount of testing we're doing. But yes, it should be made more easy, and the mobile testing thing could be good. We made it very easy to do antibody testing, and we had a lot of folk do the antibody testing. That is not as helpful as the COVID testing, but it has its place. And so, yes, I think that's an excellent idea that we have a mobile situation and target it in the communities where we know don't have cars and where we know people are concentrated. So if we bring the mobile thing You know, on this area, we can touch 30, 40, 50, 60 people quickly in an area. You know, you take it up to, no offense, but to Lewisboro, with beautiful rural environment, you can't get the concentration to make it worthwhile. We can make it worthwhile in the concentrated areas of the county. Good idea. We've written it down. We'll try to do it.
Is there anything I didn't ask you that we didn't ask you during this power hour that you would like to get out, or any message you have for the residents or anything like that?
You know, I think I'm going to double down on what I said a few minutes ago, and I mean this sincerely. You know, my election for county executive, I do not confuse with what Pentecost Sunday was in the Christian faith. If folk who are Christian know, Pentecost Sunday is the day in which the 12 apostles had the Spirit come upon them, and they could speak in tongues, and they could pass the message of Jesus to everybody everywhere they went. They went from fishermen to preachers. Election day does not convey that to those of us who are public officials. I've been around a long time in a lot of different offices, been through a lot of elections, and I know well that the election is the beginning of the process and the beginning of the term. And we are trying very hard, flawed people, not fully available to know every possible thing. We're trying very hard to figure out what to do to make this county better. It's a very diverse county. You have poor people in this county. You've got very wealthy people in this county. You've got a lot of middle-class people in this county. You have a much more diverse county. You go to your friends in Brooklyn, and you talk about Westchester, they think everybody is white, rich, horses in the meadow. This is where Rob and Laura Petrie lived in the Dick Van Dyke Show. This is where Don Draper and Mad Men got on the train to go into the city. You know, George Soros lives here. You know that Bill and Hillary Clinton live here. But having grown up on South 14th Avenue in Mount Vernon, there's a lot of other people. Jared Smithrick grew up here. Butch Gladden grew up here. Bobby Hall grew up here. Donald Bailey grew up here. Those are friends of mine from that neighborhood. All of us are in our 60s. Start out, you guys, if you're watching. But it's a diverse county. And that's what we're trying to figure out. During our time here, however long or short it is, how can we do the best possible job for the greatest number of people? And then when the time is right, salute and go and let the next person do it. And if we keep that attitude about us, then we'll accomplish some things. They've already named the building after McCallion. They ain't going to name the airport, after a county executive. It will be whatever I believe in my heart after I leave this office. And, hopefully I have some years of retirement to enjoy life. I got grandkids and whatnot. You'll look back and you'll say, hey, we had this opportunity. We did some good things. We put the thing on the right path, and now it's moving in that right path. And that's where we're at. So if we make a mistake, shout out on us, help us figure out what the right direction and the solution is, and we'll do the best we can. And hopefully we'll have progress. And that progress will allow us to sit down and have some sense of satisfaction whenever the end of this experience comes. And if I can do that, AJ, Damon, I'll be very happy, man.
I'd like to thank you for your transparency too. Most people don't know. So you kill my inbox of your office is always sending, we got these meetings, we got this going. But it's very transparent, and it's 100% transparency over your predecessor. And more elected officials need to do that to their with especially the local media and getting the word out. They need to do that, and you definitely are very transparent. So I definitely appreciate that. Any last words, Damon? Anything you want to say?
No, I think from one of my first meetings with George, he said, man, I can't change 30 years in inequity in one term. and you're absolutely right. But I think from what I've seen and from what you've been trying to do and working with local organizations, I think you're making a great strides at it to try to change what you can change within your office, and that's appreciated. We hope that you run another term. Then after that term, I'm retiring. So I'm
You're
out.
old, brother. I'm waiting to start to go gray.
When you leave, I'm leaving. But thank you for giving us your time today.
A pleasure.
And talk about a lot of issues that are important to our readers and people that watch the radio show. Thank you, man. It's appreciated.
It's a pleasure to be with you. Stay safe, gentlemen, and I'll see you out there in the real world.
All right.
Absolutely,
definitely.
absolutely. And thank you for we don't endorse a lot of people, but thank you for making us look good for endorsing. We've endorsed one or two people. We've endorsed one or two people that people are like, "What the hell was wrong with y'all?" So thank you for making us look good. And have a good 4th or whatever you may be doing for the weekend.
Happy 4th, gentlemen. Happy 4th to you and yours.
Yes,
all right.
Thank you, brothers. Wear a mask.
Absolutely, absolutely.
Here we go.
I got mine. And with that, we're out. Thank you for everybody tuning in. Sorry I couldn't get to everybody's questions. There's a lot of people that tuned in from throughout the county. Robin Mack, Angela Ferris. Shout out to Lorraine Lopez. I did not send her the link to today's show. I apologize.
Oh, you're in trouble. You are in trouble.
Well, hey, I just woke up, so I'll say it on the air. Louis Sonny Williams, Catherine Ray, Claudette Giles, Lou Young, Nadine McKenzie, Jeff Monroe, who else? There's several other people. Stephen Simpson, John Carlo, Marvin Church, shout out to Marvin Church, Kathleen Ray. Huh?
Lauren Kadar.
Yes.
Eddie
Johnson.
Margarita Sims. I'm not sure if you know.
Clyde Freeman.
Kathleen Ray.
CC Solberg said, that sounds like a nice package. You out, Damon? We was talking about the retirement. Jesse Van Loo, Mark Stuckey, Peter Senior, Guapo Davidson, Tony Money Marvelous, Nancy Cater Maldonado, Laura Prang. You said Laura Cater.
Yeah.
And Anitra Gerald Hadley, Marguerite Sims.
Jerome Rice.
You're right. Councilwoman, youngest Councilwoman Shanae Williams, Marguerite Sims, Jonathan Diggs, Mount Vernon City Court Judge Adrian Armstrong, Mount Vernon City Court Judge Nichelle Johnson, Vivian Spady, Luis Cherico, Dawn Seawright, Alex Harrison, and everybody else. We used to be doing anything else, but you decided to ride with us. We greatly appreciate it. This is the Black Westchester Power Hour. Until next time, peace.
Peace. Take care.
Peace.